What to do if? A COVID-19 decision guide from the Black Coalition Against COVID. The most obvious time to get tested for COVID-19 is when you have noticeable symptoms: a cough, sore throat, minor congestion, low-grade fever, headache, fatigue, and loss of taste and smell. If you were exposed to someone who has COVID-19, you should get tested, whether or not you have symptoms yourself. This test should be done 5 days after exposure. CDC definition of exposure or close contact is being within 6 feet for a total of 15 minutes or more over a 24-hour period. Get tested between 3 and 5 days after traveling internationally, regardless of your symptoms. If you're traveling domestically, fully vaccinated people should get tested only if they develop symptoms. Unvaccinated people should get tested 3 to 5 days after returning. Before attending gatherings, you should use home tests or PCR tests before attending gatherings with people that you don't live with, especially if you don't know everyone's vaccination or booster status. A person with COVID-19 is considered infectious starting 2 days before they develop symptoms or 2 days before the date of their positive test if they do not have symptoms. The original variants had an incubation period of 4 to 5 days, but with Omicron, it is 2 to 3 days. Currently, there are 2 types of diagnostic tests: molecular RT-PCR tests that detect the virus's genetic material. These require testing by a laboratory service and often requires 1 to 3 days to get results. This is the most accurate test option for determining the presence of a virus. The PCR test is not a test that we can use after a COVID infection because it is so sensitive that it can identify traces of the virus many weeks after a person is no longer infectious and can stay positive for weeks to months. Antigen tests are tests that can detect specific proteins on the surface of a virus. These are home tests that provide results immediately. While they're not as accurate as PCR for initial diagnosis, they can have a very useful place in our COVID arsenal. Samples are typically collected with a nasal or throat swab or saliva collected by spitting into a tube, and the results are available in 15 minutes. The test is most accurate if you have symptoms of COVID, and sometimes the test can read negative at first, but becomes positive as the exposure progresses. So feel free to retest, as that's why the kit contains 2 tests. Quarantine separates and restricts the movement of people who were exposed to a contagious disease to see if they become sick. Isolation separates infected and sick people with a contagious disease from people who are not sick. Health officials recommend a sick room or area for those who are infected and a separate bathroom if possible. That means you should stay in a separate room and use a separate bathroom from other people in your household if possible. You should also wear a mask if you have to be around other people. Avoid sharing items like cups and towels, avoid public transportation, and generally avoid contact with other people. Monitor yourself for symptoms. You will likely get specific instructions from your doctor about what to watch for, which might include things like taking your temperature every day. If you have received your booster shot, you do not need to quarantine after an exposure, but should wear a mask for 10 days following the exposure and get tested at day 5. If you're traveling home after a visit and are vaccinated and asymptomatic, you can do so by car with other vaccinated and asymptomatic people or by commercial transportation as long as you follow the masking requirements. If symptoms do occur, you should immediately quarantine until a negative test confirms that the symptoms are not due to COVID-19. Quarantine by staying home for 5 days. After that, continue to wear a mask around others for an additional 5 days. If you can't quarantine, you must wear a mask for 10 days. regardless of vaccination status, should isolate by staying home for 5 days. Assume that you are infected and can spread the virus to others. If you have no symptoms or your symptoms are resolving after 5 days, you can leave your house, but continue to wear a mask around others for 5 additional days. If you have a fever, continue to stay home until your fever resolves. Don't forget to tell your close contacts that you have tested positive and that they may be exposed. COVID symptoms can appear anywhere from 2 to 14 days after someone is exposed to the virus. Anyone with symptoms should get tested for COVID immediately and contact your healthcare provider. You should immediately quarantine until a negative test confirms that the symptoms are not due to COVID-19. If you're having severe symptoms, call your doctor's office and get their advice, because there are, of course, other things like the flu that are out there and can mimic COVID symptoms. If you're having mild or lingering symptoms and your at-home test was negative, retest in 3 to 5 days. That's why most of these kits actually come with 2 tests. When you have tested positive and have symptoms, the CDC urges those who have or may have COVID-19 to watch for emergency warning signs and seek medical care immediately if they experience symptoms including trouble breathing, persistent pain or pressure in the chest, new confusion, inability to wake or stay awake, pale gray or blue-colored skin, lips, or nail beds, depending on skin tone. They do not need to see the doctor if there are no COVID symptoms, but your child should quarantine at home for 14 days and watch for symptoms. They do need to get a COVID-19 test. If needed, the CDC says that you can shorten your child's quarantine to 10 days as long as your child shows no symptoms, or 7 days if your child has a negative COVID-19 test on or after day 5. Monoclonal antibodies are laboratory-produced molecules that act as substitute antibodies that can restore, enhance, or mimic the immune system's attack on cells. For COVID, monoclonal antibody treatment is available to individuals with serious disease, but they must be administered within 5 days of when you first started developing symptoms, test positive for COVID-19, and have mild or moderate symptoms for 7 days or less, and are age 65 or are age 12 and older, weighing at least 40 kilograms, and meet one of the following criteria: overweight as defined by BMI, pregnancy, chronic kidney disease, cardiovascular disease, diabetes, Down syndrome, dementia, liver disease, current or former smoker, current or history of substance abuse, immunosuppressive disease or immunosuppressive treatment, history of stroke or cerebrovascular disease, chronic lung disease, sickle cell disease, neurodevelopmental disorders, or you have a medical-related technological dependence. Post-exposure preventative monoclonal antibodies are available to those who have been exposed consistent with the CDC's close contact criteria and who are high risk for developing severe COVID-19 and not fully vaccinated or vaccinated but immunocompromised and 12 years of age or older. For more information, please visit us at blackcoalitionagainstcovid.org.